To our COVID coverage now, in California taking new steps to try to slow the Omicron variant.
First, all healthcare workers are going to be required to get their booster by February the 1st, and that will include employees who work in nursing homes. In the meantime, healthcare staff should be getting tested twice a week until they have that shot. Second, the state is providing more at-home COVID tests for students so they can get tested before they return to school from the winter break. State Department of Public Health distributed about 2 million COVID tests to schools.
And lastly, the state will be expanding the availability and hours for those wanting to get a rapid antigen test. Governor Newsom pointed to rising cases as he announced his plan. This graph shows the number of cases reported each day since March of last year. There it is. You can see the line starting to move up again. The governor said new cases have doubled in a week from 5,400 to 11,000. Still, this time last year, cases were near 50,000. And
the governor also says that California has the lowest test positivity rate in the country, but that it is going up. Stands at 3.3% right now, and about a week ago it was 2.3%. Well, the first COVID antiviral pill treatment is now authorized in this country, and the studies are showing that it does reduce the risk of hospitalizations and death by 88%.
KCRA3's Christopher Salas live in Washington this morning. And Christopher, when will these pills be available to the general public?
Teo, Deirdre, good morning. Pills are made by Pfizer, and the company says they can deliver them in the United States immediately. Now, there are a couple issues, including limited supply. The company said by the end of January, it will have enough pills to treat more than 250,000 people in the United States. That's less than 1% of the population, but by the end of the summer, that number should be up to 10 million people. Another problem right now is this highly effective treatment has to be administered within the first 5 days of symptoms, which means there's a narrow window for treatment, and already hard to come by tests are even more difficult because diagnosis, or even more important, I should say, because diagnosis is going to be vital. Despite the challenges, the Biden administration says it's another step towards overcoming the pandemic.
As we face Omicron, the nation's medicine cabinet of treatments gives us more options to protect the American people. It's yet another reason this moment is much different than March 2020.
And there's another antiviral pill, this one from the company Merck. It is expected to soon get authorization from the FDA. However, that pill is less effective. It also has more side effects. Deirdre, Teo.
Christopher, we're also learning more about Omicron every day. What are some of the latest studies on this saying?
Yeah, so Teo, there are 2 new studies out of the UK. One of them shows that the likelihood of being hospitalized with Omicron is 20% lower compared to Delta. And then there's another study that shows you have as high as a 2/3 less likelihood of being hospitalized with Omicron compared to Delta. Scientists warn, despite this being very optimistic news, Omicron is still more infectious, it's still more contagious, and it is more likely to evade vaccines.
All right, Christopher Salas live in Washington. Thank you.